Okay, so this is part two of knowing your fetal movements. If you have been following me, you know, if you watched the first video, I was trying to explain how you know excessive fetal movements, reduced fetal movements, you know, when you start noticing your baby's movement, and it's very, very necessary. If you're pregnant, you need to listen to this video. So I was talking about counting or tracking your fetal movements, your baby's movements. You know, you have to know your baby's movement because it will help you a lot. So I was trying to, elaborate, the number of times a baby is supposed to kick in 1 to 2 hours, in 2 hours, like up to 10 times. And I was saying that within 2 hours, your baby is supposed to have kicked at least 10. But this varies, everybody is not the same. Some women may have five, three, four, you know, there should be a pattern. So that is why it's very necessary for you to study how your baby moves. So that when there is an excessive movement, you know. When there is a reduced fetal movement, you know. Some women, position can affect the movement of the baby. So if you're not keeping track of this movement, how will you know your position is affecting your baby? Some women, when they lie down, maybe lie down in an abnormal position, you see the baby start moving. The baby will start moving so fast. Do you understand? Some women, maybe while they are doing their domestic work, maybe the position you are staying to do that or wash or sweep or do that, you find the baby, there's an excessive baby movement that signals that something is wrong and the baby is not comfortable. And if you're observant, you know. If you're very much observant, you know, and you have to adjust. What the baby is trying to tell you is that adjust, I am not comfortable. But most people don't take notice of all this. So the baby is trying to tell you to adjust, I'm not comfortable. So when you start noticing excessive fetal movement, check your position. Maybe the way you're lying, the way you're sitting, your position, the way you're doing your half shot, the way you're bending. It's not good for a pregnant woman to be bending. Excessive bending is not good. It affects you, especially when the abdomen is protruding. It's not good that you bend a lot because as you're bending, you may be compressing some blood vessels supplying to the placenta. So most times where you have fetal stillbirth and death of fetus is when there's a reduced blood supply to the baby. So your position can cut off blood supply. So that's why sometimes there are things you'll be doing and you notice that the baby is moving excessively. You adjust. When you adjust, you see that the baby will, the excessive movement will stop. So apart from that, if you start noticing excessive movement, then you change your position, do this, do that, and there is still an excessive movement for some time or even days. You shouldn't wait up to days, in within 24 to 48 hours, 24 hours, not even 48. Within 12 to 24 hours, you've noticed that your baby's movements have drastically increased. You call your physician, call your midwife or your doctor's attention. Let them check you or check your baby. So then if there's a reduced baby's movement, reduced fetal movement, it also calls for an attention. Maybe the way your baby is moving is not the way the baby has been moving. There is a sluggish movement. There is, reduced movement. Maybe when you count, you used to count up to 5 in 2 hours. All of a sudden, in 2 hours, you'll be counting 2 or 1. There's a problem. In 2 hours, you count 10. Then in 2 hours, you now count 5. There's a problem. In 2 hours, you count up to 7. Then in 2 hours, you're not counting up to 2. You know, it may not be 100%, accurate that something is wrong with your baby, but it's good that you seek a professional advice. Let them rule out. Do you understand? It's good that you call your doctor or your midwife. I noticed that my baby have reduced his or her movement, and she or he will tell you, okay, come over, let's check you. Then you are just assuming you don't even know until something happens. So now, how do you count your fetal movement? Number one, you have to lie in a comfortable position, left or right. Just lie, stay in a comfortable position. Do it when you are not busy, when nobody will distract you, not when you're busy. No, no, when nobody will distract you. Then take a timepiece, place your hand on your abdomen, and start counting within 2 hours. You can count up to 1 hour, you can count up to 2 hours, depending. Do you understand? You can do that every day for some time or alternate day and determine a pattern. Know the pattern at which your baby moves. It will help you a lot. So knowing the pattern, when there's a reduced movement and you count, and this is not what I got the last time, it will also help you to draw the attention of your healthcare provider. So knowing your fetal movement help to reduce fetal death or fetal dismiss. So many people, they are pregnant and they don't even know when the baby have stopped movement, fetal, when there is fetal death. Sometimes the baby will start, there is dissemination and they don't even know. It's when they come, they will tell you over 1 month, over 2 weeks, over 1 week, you've not heard, you've not noticed your baby's movement. No, now. So I think if you're pregnant and you're watching this video, please ensure that you notice it. You start observing it. Do you understand? Make a conscious effort to observe how your baby move. It will really help in determining the well-being of your baby. Do you understand? So I hope this video helps somebody out there. If you find value to this video, try to subscribe or follow my handle on TikTok and Instagram and Facebook at the Midwife Notes.